Hi, I'm Rebecca Brand, and this video is about healthcare rationing and the need to do so as we're getting very close in California to having full capacity at all of our ICUs. I'm also going to be talking about how we have to share our resources in our emergency rooms because other counties are filling up all around my county in Santa Barbara. And how does this relate to where you live? What is going on? So I'm going to be going through all the stuff happening and that now we have to think of rationing. What does that mean? What is rationing? Well, as you might have heard, healthcare rationing is when they stop taking patients at emergency rooms. And they have to decide anybody that's going to get COVID care, they're going to have within some parameter. How are those decisions being made? Let's talk.
Today being the third deadliest day in the U.S. for the pandemic so far, with more than 3,000 dead. The state of California just ordered 5,000 more body bags. All of New York's hospitals are all shifting to crisis management mode.
And crisis mode means rationing. That's what that means. Hi, I'm Rebecca Brand, and I'm in front of Ventura County Hospital today. We are at capacity with our ICU usage. The whole state of California is shut down at this point because we don't have the capacity in our ICU rooms in California. This is the Ventura County Hospital. Ventura County has been hit horribly with COVID. In the past couple of weeks, cases have doubled. Their emergency room beds are so full, they're starting to try to transfer patients to other counties, like Santa Barbara County. Santa Barbara County has less occupancy than most hospitals in all of California. There is controversy about whether we should take patients from other counties since we have some capacity. But if you take a patient for COVID and they end up in your ICU, those stays can be, up to 3 weeks or longer. There's like a minimum 7 or 8 days. Oh, there's people gathering there at no mask. Let me show you that. It's shocking because I'm at this hospital. Everything here, and then we walk over here, and then there's a bunch of people just hanging outside.
Yeah, and I definitely
Of the coffee place. All 4 of those people do not have masks. Coffee, going into Simone's. I got my latte, and the lovely gal just came and brought it to me because I did not want to get near all those people. This hospital is just so beautiful. It's state of the art. People entering the hospital are there in the front. They're wearing masks. Those probably are not the COVID patients. I think the COVID patients would be going right to emergency and ambulances. So it's quiet today, but they're at capacity is what I understand. Santa Barbara's capacity today is at 56% of the ICU. So we have a very ethical question to ask. Do we take people from other counties? We have been taking cases from other counties. We took a couple, but then our health director, Dr. Ventura, said, that's it. We can't keep doing that because if we do, we're going to be out of space for us. But how do you turn someone down when they are asking for a bed from someone that might die? I just think, who wants to be that person on the phone, and do we do it? I don't know. I mean, what's your answer? What do you think? How should we handle that? That is the big moral question going on right now in our county, Santa Barbara. Maybe the other counties don't have to have that question because they're already full. They have to send them away from the emergency wards. Right now, I'm at the Community Memorial Hospital in Ventura. That hospital has a 96% ICU filled up. 96% capacity is what's used up. That means 4% unused. I don't know how they get that number, 4%. That's, what is that? Half a bed? Doesn't make any sense to me. Ventura County is twice as big as Santa Barbara County. They have about 900,000 population, and Santa Barbara has about 450,000. They have a couple of hospitals in Ventura County, like Santa Paula, that has lower occupancy rate. So, they're probably going to be sending their patients to those until Ventura County doesn't have a thing left. So what is that going to be? Another week until Santa Barbara gets the Ventura County people into their hospitals? I'm sure other communities around the world are facing these issues. And then we get into the worst question of all. And that question is rationing. Who gets to get a bed and who doesn't? And are they going to be doing triage right outside here of this emergency ward? How is that going to look? It seems to me they are getting ready for some type of overflow or something right here in this parking lot with this tent. It's not a drive-through, it's a tent. That is pretty scary to think about. What are the plans for that tent? Now, Santa Barbara has some other hospitals. We have the Goleta Hospital, and it's a great hospital. And it has a lot of capacity. I think 7 beds unused, like 16%. They don't have a lot in the ICU. But the deal is, if you live in outlying areas of your county, do they have the best doctors there? Is it staffed with a lot of, this is a specialty. You got to intubate people. I think you'd want the best intubator and the best ICU room. And that would probably be at your larger hospitals in your counties. Just saying. It's a worry. So if you had a mother, kid, whomever with COVID, where do you want to take them? You would figure out real fast what's the best hospital. But it might end up, what's the only hospital in your area that's opened? And then you have to say, well, Santa Barbara Hospital, or the best hospital in your town, my town, it's Santa Barbara Cottage, they're now doing rationing. And I mean, we're talking 1 week, and that's going to happen. It's immediate, it's emergent. In many states across the nation, it's already there. If you live in one of those states and you know about this, please comment, please tell us, please inform us. This is a community bulletin board going on my YouTube channel. And every single comment under the sun, and I'm so happy to read them. It's so fascinating, and other people share different points of view. Just don't swear. Okay, now let's go see Santa Barbara. As I'm leaving Ventura, the town of Ventura is vibrant, it's bustling, it's busy. It's got industry here, it feeds its whole county. And as you look at all the town over there, and then I'm going to pan over and show you the ocean. Look at what a beautiful, amazing town this is. Look at the waves. You can even see the islands today. It's so pretty. And it's the 16th of December. I mean, we're talking December here with incredible, beautiful weather like that. Well, as part of this order, it's only essential travelers at all can come and stay overnight in hotels and things. And I'm in media, so I get to do that, thank goodness. So I can bring you this report. But it's really shut down. But I hear sirens back there. I wonder what's going on. I hope it's not a medical emergency, or any emergency, really. I had stop and go traffic. Now, where are these people commuting to? I just don't know. They screened me tight at that hotel. I had to show my media badge and everything. That's good. They're following the rules. Recently, the city of Santa Barbara and the county of Santa Barbara and lots of California got shut down. So all these restaurants out here have been closed for outside dining. There's only pickup, and then we have a revised hours. This is in front of the famous Lucky's restaurant in Montecito. Those tarps on the ground had been on top of the restaurant. It looks like Lucky's was putting up a rain kind of tent. And in 5 minutes, those tarps came off the top of that structure. And back to this truck to be taken away. And I'm guessing that's because there's probably a rental on the ring structure, and with nothing going on for outdoor dining, we have to wait 3 weeks before we possibly can open up again. But with this capacity issue, it's looking very bleak. This restaurant looks like they are just getting rid of all their umbrellas too. New York won't be able to open up again until capacity is below 70%. If you scroll down this graph, you can see California is quite lenient by needing 85%. of ICU capacity before it can open up again. You know, New York is down to 70%. They're being much more conservative than California. It's pretty sad to see what's happening in Wisconsin, and it's pretty sad to see the last part of this graph, which is if you're at 95% ICU capacity, you better be opening up field hospitals. What a state we've come to. Well, I'm here at Santa Barbara Hospital in the center of Santa Barbara, our largest county hospital. Here is our emergency ward, and we have 3 ambulances lined up. Our ICUs are at 56% capacity right now. We have people arriving into the emergency room. As I'm standing here, I just randomly came here, and there was somebody being wheeled in. Who knows if he has COVID or not? Let's hope he doesn't. But the emergency room is certainly the first point of entry for all patients, with COVID or not COVID. I didn't see that guy wearing a mask as he was being wheeled in. And hopefully that means he doesn't have COVID, or that's not why he's there. Next team of doctors arriving. The ambulance business must be pretty busy these days. I hope those essential workers are okay as they do their jobs. A person being admitted with a lot of people around him. Let's all pray for his health and his recovery, like everyone in our whole country. Let's pray for them. And so rationing means that our health care needs to be decided who gets help first. It gets into the ethical questions. Should we save the old, or should we save those that are young and more healthy and more likely to survive? Until now, rationing was just an academic endeavor. But now with our hospitals filling up, we must decide how we're going to allocate our limited healthcare resources. Doctors do not want to be in hallways trying to decide which patient lives or which patient dies. And so now they are scratching out plans and policies for rationing. Rationing happens as hospitals are overwhelmed. They're not going to have enough equipment or enough personnel to manage these times. As our ICUs fill up, then we have to figure out who is the one that gets the most medical care and who is the one that doesn't. Survival rates are what we need to go up now that the infection rates have gone up. Currently in New York, there are lines and lines of ambulances waiting to bring in patients to filled up emergency rooms. And with those long waits, you just hope the patient survives to get in to receive the medical care they require. When patients are waiting to be seen by a doctor and there's no more doctors to see them, lines form, and these people are waiting and waiting to get in. How long can that happen? Who gets the care first? Which ones are sicker? Which ones need attention right now, and who will we give it to? This is a picture from a makeshift ward in Boston where there's too many patients to fit in the hospital. That when someone is coding, when their vital signs are diminishing fast, it takes many doctors at once. Those resources are going to be pressed thin, and this is why rationing needs to be developed ahead of time before the hospitals get to that point, and needs to be decided on in different communities, including my own hospital in Santa Barbara. I'm Rebecca Brand. I hope you might have gained something out of this video. Please comment below and give me your thoughts about what's going on, where you live. Tell me your state, tell me your town, what's happening, how are you perceiving this spell of COVID. This is middle of December right now in the United States, where things are out of control. Subscribe to my channel, please. Ring the bell to get notified of my next video. That's really important, especially if you like this series of COVID videos. I cover all kinds of things on my channel. This is my COVID series. And I appreciate you very much watching this video, and I'm wanting you to be safe and healthy. And please take precaution. Please don't get sick. And if you have been getting sick, if someone you know got sick, Some of the most impactful comments down here are when people write their experience of that. It's a community bulletin board, and I care, and a lot of people care with your comments. Okay, I want to end with a smile because there's a lot of silver linings in life, and we'll talk about those too on my channel. Okay, I'm going to sign off for now. Bye-bye.